from a clinical standpoint, and then I'm going to talk a little bit more from a lay standpoint. So you'll have hopefully a thorough understanding of what depression is, how to recognize it in yourself and to others, and then some options on how to get treatment and some of the things you can do to help your mental wellness. So clinical depression is defined as a mood or disorder that is persistent, that lasts for at least 2 weeks. With the 2 weeks being very critical in that conversation. There are other things outside of just the 2 week time frame that has to be there for us to diagnose you as being depressed. But there are also things that relate to your loss of interest in activities that you would normally do as a part of your normal daily activities, and a significant impairment in how you function based on what you define as your norm. With the big piece being defined by your definition of your norm, because only you can decide what you define as normal, not per se the definition that society may provide or put upon you as your norm. So for example, if your norm is to get up each morning to run 6 miles, which is probably not normal for most people, that's your norm. So if somewhere along the line that norm for you becomes different, then that's when things for you may have gone to a point where a certain level of sadness is kicked in, and you may be moved over to a point of being classified as being depressed. So how prevalent is this? So more than 264 million people suffer from depression worldwide. It impacts about 17.3 million adults. It also impacts college students, and the number has increased over the last couple of years. And COVID has about tripled the current rate of depression among folks. So, based on people losing employment, losing their normalcy, not being able to go out and interact with family and friends, and all the other things that COVID has brought as it relates to level of uncertainty. With the uncertainty piece being the piece that tends to drive people's level of anxiety as well as their level of depression. So we normally put depression in two major categories. You have what we consider major depression. Once again, this consists of something that occurs over a course of 2 weeks. And it's something that's characterized, and I'll kind of explain what those different, because we have what I call them markers, and how we get to the point of determining if an individual has gotten there. But the key word is that it has to be something that's persistent. So it's not just having a bad day or a bad couple of days. This is something that's going to last for a course of 2 weeks or more. And then you have something called persistent depressive disorder. This is going to last 2 years or longer. And normally you see this around folks who are normally bipolar, or folks who have significant grief or loss, because the depression state and the grief tend to run together. So normally these are, once again, their durations are long periods of time. So it's not that you had a bad day, you had a rough weekend. These are things that are going to last for a significant period of time. So once again, as I mentioned, bipolar, it's a mood swing disorder. You see people who have extremely highs, or the mania stages we call it, and extremely lows. And they go through these ranges very quickly. It's not a matter of days, it could be a matter of seconds. So you can talk to someone and in 1 minute they're doing exceptionally fine. A couple of minutes later, you circle back to them, and they're struggling. They're sad, and you're trying to figure out how they got to that point when a few minutes ago they were doing exceptionally well. And then there's also seasonal affective disorder, which tends to starts normally around August-ish, late August, September. It's seasonal, meaning it happens during winter months. And the length depends on what a person has been exposed to, what kind of traumas they may have experienced in the past. You also have to factor in the fact that, like at least in the northern states, it's going to be cold, there's going to be less sunlight. And then when you factor in the current pandemic, you now also have where you can't necessarily get out and do some activities that you may have done or enjoyed in the past, to kind of break up the monotony of the day or the week, or whatever else that you may have going on in your actual world. So what are some of the signs of depression? So some of the signs look different between adults, adolescents, as well as children. But adults, once again, back to this persistent world. So it's very persistent. And the sadness that person may experience through some kind of loss, or just your overall feeling. And sometimes medication can impact that. So we have noticed that, young ladies, especially teenage girls, If they're put on birth control, for example, that can cause depressive moods in them, because their hormones also raging, and you factor in that medication that sometimes impact them psychologically. They also sometimes may be critical of themselves. They have a loss of interest in activities that they will once again define as their norm. So an activity they've normally enjoyed to do. They become irritable and isolated. And actually in this current climate, isolation is running rampant because of COVID, especially among our seniors and among our children. Their normally daily routine of getting them going to school, enjoying their friends, for some has created some challenges, as well as us seniors who, because their risk factors of contracting COVID has limited their interactions with family and friends. So that level of isolation has also created some level of depression. As Marvin mentioned, I've been in this profession for 24 years, and I've never seen it like this as it relates to the number of people who are reaching out for help and support. So hopefully, through the vaccine and some other things, we can begin to get people back to their sense of normalcy, and begin to help people deal with some of the issues they're currently facing that the virus has created. Anxiety is another issue that comes up. Mainly anxiety is impacted just based on people's thought process. And I'll talk a little bit about that when I talk about the treatment component. Loss of energy and sleeping problems. So if a person came into my office and had maybe one or two of these things, they're not necessarily going to be diagnosed as being depressed. It takes more than just one or two of these items on here as relates to the signs to be diagnosed as depressed. And there are normally other things that we'll do, whether it's conducting an assessment, getting some background information, and looking for past traumas and things of that nature. So it's a collection of information that's used to pull together your diagnosis to place someone in the category being depressed. So signs of depression among adolescents. Some of their signs show up physically, meaning they may present to mom or dad as having a headache. They're constantly having stomach aches, but you can't find any medical causes or medical reasons for why those particular conditions exist. So as a parent, if you have kids and that's something that comes, that's something you want to be aware of. Cutting also sits in this category. You may have kids who cut. So that also may be a sign that they're depressed or that some other trauma has occurred or something's going on with them that you may want to investigate. Persistent unhappiness, like I said, it ranges across all ages. That was not unique to any one age group or any one demographic. Young people also show a demonstration of anger and outbursts. And sometimes may be difficult to interact with or talk to, because that's just their way of the only defense mechanism they may have or know how to use to express their level of depression, depending on what they're experiencing. They also sometimes become, have a sense of low self-esteem. They're what I call negative self-talk, and I'll talk a little bit about that a little bit later. The conversations they're having with themselves or the conversations others have had about them may also impact them and move them into a state of depression. They also, once again, lose activity and activities just as adults do. Once again, low energy level is the same. Their appetite may change. They may have constant worries or loss or be preoccupied with death, whether that death is theirs or someone else's. So especially if they've experienced some kind of trauma or significant loss of a loved one. So that grief may very quickly turn into depression. And unfortunately, if that depression is not addressed, it sometimes also turn into, becoming suicidal. So it's definitely something if you think that either your friends or a child or some other one in your circle is becoming depressed, it's definitely something you want to interact and respond to, especially with something that has lingered for a long period of time, with that 2 weeks being that time frame. So anything more than 2 weeks, you want to be concerned about. Anything more than a week, really, you want to be concerned about because they're moving in that direction. So the sooner most folks can get help, the better. So that just allows them to have, someone to talk to, and we'll talk about some strategies for that as I move forward. So with kids, so to kind of make this make sense, do a quick understanding of child development. So most kids get their personality of age 2. So they go through what most parents and adults call the terrible 2 stage, between 2 and 4. So between 2 and 4, they got the personality at 2. So now they're trying to figure out and figure out where they fit in the world with this personality. They just understand that they now have, and they navigate things. So as kids learn to navigate things once they turn two and get that personality, sometimes they trauma, whether they witness, mom or dad being assaulted, or whether they witness violence in their community, or TV. All those things can impact kids in a negative way, impacting their ability to eat and sleep. And they're going to respond a little different. They may become a little more attached to mom or dad, being looking for them to be a comfort or a soother, or have an ability to feel safe in that environment. So once again, kids will look a little different, especially younger kids. But once again, they can experience depression as well. So depression is living in a body that fights to survive with a mind that tries to die. And the reason I bring that up, because most of the time when folks are depressed, people assume or make the thought process that they're being lazy, that they don't care about themselves or life. But psychologically, they're being impacted, and that psychological impairment has hindered their ability to function normally, and oftentimes may cause their body to have challenges. So it's more than just a physical or psychological issue. It sometimes also becomes a physical issue. So, what causes depression? So, it could be an inherent trait. Mental health, we do know that it's common in people, and it moves through bloodlines. So, it could be something they get from mom or dad or some other family member, depending on what that family member experienced as it relates to mental health. It also be environmental, something exposed before birth, but it could also be something exposed to after birth. So it goes both ways, whether that exposure was based on mom doing drugs, being exposed to certain toxins, or certain stressors within that particular environments can impact a person's ability to deal with the issues that they're facing and cause them to go in a state of depression. Brain chemistry also plays a role. So when your neurotransmitters are not connecting properly, and they begin to get impaired, as well as your nerve receptors, so that also impacts your thought process, which then impacts your ability to manage situations that are coming before you, which may cause you then to go into some form of depression, whether it's an acute form of depression or a major form of depression that requires you to either receive medication, or to wind up receiving some form of therapy. So some of the things that impact, other things that impact loss, significant loss, a death of a family member, a death of someone that's close to you, or just a general death in general, something that you may have witnessed, that creates then some level of trauma that causes a person to become depressed, not be able to control things in their environment, which is sort of what many people are dealing with today as it relates to COVID. Not be able to manage, being able to go out, being able to go out without masks, be able to interact with friends and family in a close interaction, compared to trying to maintain the 6 feet other rules that we now have to try to keep people safe from COVID. Having unrealistic expectations. For the clients I tend to see, that tends to be the most common one. Is their expectations not being realistic has caused a certain level of depression. Whether it be I've gone out for 5 different jobs, and each job that I've gone out for required a certain level of qualifications, and I had none of those qualifications, but I got none of those jobs, and not understanding why I didn't receive the actual job. So helping people understand what's logical, what's realistic, and helping them manage that would also then help manage their depression. Disappointment sometimes can become an issue. It's not as common as some of the others. Perceived failure, and negative thinking, or as I call it, the self-talk, that talk that you're having with yourself. Whether you're telling yourself, I'm not good at certain things, I'm terrible at this, or you've listened to other people provide bad feedback about you, and that begins to determine how you function or how you see yourself. So that negative talk is also something that we work with, and I'll speak to that a little bit more towards the end of the presentation. So coping with stress, or depression. So how do you do that? One way is to build structure in your day. I always tell clients when you first wake up, you should set your day. And what I mean by that, you should set what you plan to get accomplished for that day, and make a list of all the things you want to take on. But also remember, if there are certain things on your list you don't get to take on, you can still have tomorrow. But you want to focus on just that day and that day, and manage things based on that day. You can't change what happened yesterday. It's gone forever. You have no idea what's coming at you tomorrow. So all you need to focus on is what you have at that particular moment on that particular day. Also build pleasure and fun in your day. Try to make sure throughout your day there's something that you enjoy that you take advantage of. Something that can be done fairly quickly, something that doesn't require a lot of time, because depending on what your schedule is like, whether it's from work or family or children or other kind of commitments you may have, there are a lot of things you can do to help meditate, because that's something that can be done fairly quickly. Or if you're an exercise guy, participate and stay active, and find an hour or a half hour a day to make sure that you continue to exercise. Get plenty of rest and sleep, which is exceptionally important. Eat balanced meals to make sure that you have the proper nutrition to fuel your body. And once again, the challenging of the negative self-talk. Uh, that conversation that you're going to have with yourself is beyond vital important. We have a lot of negativity that comes at many of us, especially African Americans. So you want to have time to just think about the good things about not only yourself, but the things that you can control, and making sure that conversation that you're going to have with yourself is a positive one. Because there's probably going to be enough people in our world and society that bring negative things to you or say negative things about you. So you need to limit that by one. And that limit by one is you. Take yourself out of that equation and make sure that the conversation that you have with yourself is a very positive one. And remember the gift of time. You know, as even as I'm speaking now, time is elapsing. So that time that elapsed, you don't get back. So just appreciate the time as you have it and as you're going through it, and look at it as being a gift. So how do you treat depression? So some of the things that we do individual and group therapy, depending on where a person is at and what their needs are. There are a variety of different approaches that we can use. There's medication. I'm not a big proponent of medication. I think there are a lot of other things that we can do to help clients other than a pharmaceutical intervention. So I always try to push those first. Obviously, there are some folks, depending on how their brain chemistry is made and how they're functioning psychologically, medication is required. But normally I use it as a very last step. Unfortunately, I do have colleagues that use it as the very first step, but I like to try to do a variety of other things before we would put a client on medication. Stress level and reducing the level of stress that you have that you can control is also important. Making sure that you put yourself in environments where you're going to be at peace, and limit the number of environments that you have to go that are chaotic or disruptive for you. Exercise and sleep, once again, are also important. You also want to avoid the level of alcohol that you may consume and try to avoid drugs altogether, because they do change your chemical balance. Once again, going back to when I mentioned, like if you had a young lady who you put her on birth control during her teens, those hormones and everything else raging changes and impacts her brain chemistry and may causes her to become depressed. Alcohol and drugs can do the same thing. We also would do some kind of psychological assessment, like the PHQ-9 or the Beck inventory. Those are normally assessments that are done to determine, not only looking for the factors that I identified before to see if a person is depressed, but you also want to do an assessment to confirm that. So there's a lot that goes into us making a determination to decide if an individual is depressed or not, and then what would be an appropriate treatment format to help that client move forward and get where they need to be and get back to what their definition of their norm. So I've listed here a few mental health resources. There are a variety. List one for each county. There's some national ones that are there. You have the National Suicide Hotline, the National Alliance for Mental Health. In Detroit, you have the Wayne County Mental Health Authority. You have the Oakland County Common Grounds, and you have Macomb County's Mental Health. So normally I always tell folks, if you believe that you have some kind of mental health issue and you need help and support, please reach out. If you don't feel that you can talk to someone within your family or someone else, please reach out to a professional. Or you can always call, like I said, one of these helplines that I have listed here, to seek help from an individual to help you manage it. One thing I like to help folks understand is when you're depressed, it just doesn't go away. There are going to be some things you're going to have to do to manage that depression. Whether that means you change your thought process, you regulated your negative self-talk or your mind chatter that you're having with yourself, or you went and saw a therapist. But normally depression doesn't go away on its own. There are going to be some efforts, some work you're going to have to do to move yourself out of that depression. Some things you maybe do on your own, and if not, I strongly always recommend reaching out to a therapist. Now, one of the things I always hear when I do these talks is people say, well, if you go see a therapist, everybody thinks you're crazy. Well, every human being has issues, all of us. And it's just a matter of what kind of issues do you have, and are the issues that you're currently able to manage, or are the issues where you need additional information? Because that's what the therapist does. It's our job to provide you a different level of information to help you better deal with the issues that you're facing. So it's not that we think that you're crazy. We think that something's really wrong with you. It just means that your coping skills, based on what you're being currently presented with, may have overwhelmed you, and you need new information. And need new information to help you manage the problem that you're currently facing. And I've yet to meet not one adult who doesn't sometimes need new or additional information to help them manage a particular problem or situation. So coming to see a therapist is not a sign of weakness. It's not a sign that I really lost my mind. It's not a sign, shouldn't be a thing of an embarrassment. It should be that you need information and you need to seek out someone to help you obtain information that you need to go back to function the way that in which you want to function, or to optimize your functioning. Um, so the next slide after this is just questions. So I like leaving this slide up as I ask or answer any questions that anyone may have. That way folks have more than ample enough time if they want to write down the numbers that are listed here. So at this time, I'll take on any questions.